Hello, everyone, and welcome to our latest episode of the Pharmacy Podcast. Here at the Pharmacy Podcast, we talk about all things pharmacy, the pharmacy team, and we have some amazing guests. Here with your hosts, myself, Yaz, and Jin. And today is no other exception. We've got an amazing guest with us. We've got Abid, who is the clinical pharmacist at Rayleigh PCN. So just to kick us off, Abid, do you want to introduce yourself to us and tell us a little bit about yourself?
I'm Abid. I'm a pharmacist. I've been a pharmacist now since 2012. It feels like donkey's years that I've been a pharmacist now, especially when you see the new guys coming in and it just makes you feel old. Um, I started off in community pharmacy, and 6 years ago I made the jump from the community to primary care. And in that time, starting off as a pharmacist, then doing prescribing, then doing the ACP course, and along the way doing various other little bits and pieces. I'm now the team leader in Rayleigh PCN where I work. So I look after the whole kind of PCN team, effectively, all the clinical guys. And also on the side, me and two other pharmacists, we started the Pharmacy First training company to help people get ready for Pharmacy First when it launched in February.
Is amazing. So there's tons to unpick there. So we're just going to take it like way back and kind of start from the
That's
beginning. Okay. So so you say you went to uni, did your MPharm, and you started off in community. Did you always want to do community? Was that kind of the direction you thought, okay, this is where I want to go
Yeah,
and stay? Or yeah, how did that kind of come about?
yeah. So going into community, because the thing is, back then the only thing I was worried about was actually who's paying the most, who's paying a decent amount, right? I had no idea what community, hospital, industry, any of those involved. So I was like, right, community pays all right, hospital pays meh. So I was like, right, I'll go into community. Um, and I went into community, and to be fair, I loved it. I I I, I went to work initially for Boots. Um, I spent just over 5 years in Boots. So I went from pre-reg to then qualifying, being a relief pharmacist, and being store-based for another 2, 3, 4 years. Um, and despite how I felt about the company, I love the patients. I love the patient interaction, the relationships you make with these guys. They come in every month, every 2 months. The fact that people are walking and I'm like, "You're right, Linda. You're right, Mike.
Oh,
How's your kids? How's your daughter? How's this? How's that?"
yeah.
Or it was brilliant, and just the fact that working in the city as well, because I was based in London, it has its own unique challenges. Whereas I've worked now in kind of the more local, based in a village, based in a small town pharmacy, based
Mhm.
in a surgery pharmacy, based in a health centre pharmacy. But when I first started, and you're based in the city, it's like you're the first port of call for everything. Patients that work in the city don't live in the city. So they're all coming to you as a pharmacist to say, I've got this issue, I've got that issue. What can I do? What can I do? And in that sense, the clinical aspect was quite good because you were very hands-on with everyone. Um, so yeah, I loved community pharmacy. Even when I left Boots and I went to work for Well, and I was
Mhm.
based in this tiny little town near Brentwood called Hutton, and working like going from a very corporate set Boots environment to kind of going into a Well pharmacy and going, you're the pharmacy manager, do what you want here, basically. And that was like, right, chains are off, I can do whatever I want. And I loved it. And I was like, right, I was ordering stock that was off plan, I was doing this. All our targets we smashed because it was just like, right, I went in with serious like zeal to kind of just do something different and make an impact. And I loved it. Um, Literally, even when I moved from Hudson to a little town called Aveley, just next to Lakeside, I was there for just over a year, but walking down the high street, I'd know everyone on the high street.
Mm.
In the morning, I'd park and go to the surgery where the pharmacy was based, and there's all these parents with their kids, and the kids all knew me, the parents all knew me. So yeah, that was lovely. And then you go to the co-op, the person behind the counter, the
Yeah.
person behind you in the till. So it's proper like small community vibes. It's lovely.
Oh, I really love that. It kind of like brings like the human side to healthcare, you know? And I know everyone's like, oh, healthcare should really be patient centered. But when it comes to like targets and doing things, it can kind of take away that,
Yeah.
really kind of human focus. Oh, I really, really like that. One of the things I was going to ask actually is, so you mentioned when you were working for Boots, it was kind of restricting in what you could do, what you couldn't do. How did you navigate that with like, because I'm sure a lot of our listeners as well are in these positions where they have to navigate their relationships with their area managers or even their non-pharmacy managers, or, how did you navigate that to kind of feel, I guess, happy within your job and also be able to do the best job that you can?
I know it's going to sound cliche, but I always put the patients first, right? So anything that I did was actually based on how is this going to benefit my patients? How is this going to benefit the healthcare needs of the area? You know, the area managers just kind of left me to it because to be fair, look, the area managers, all they're concerned about is whether your performance is on track, whether you're delivering the deliverables, the money's going in the till, basically. And I worked to kind of make sure that we offered all the services we could. Had our diaries that we managed fully booked all the time. We offered all the different services that we could get trained up for. And I had a fantastic team in there. Don't get me wrong, I'm not sitting here going, I did it all myself. My other pharmacists, my dispensers, the healthcare team. Um, and there was a period where I was based in Moorgate for about 3 years. Um, and in that time, we kind of had, I think we started off, when I first got there, there was no manager. The manager has just left, and the pharmacist has just left. So for the last 3 months, while they were both kind of on their way out, they both basically stopped giving a damn. So I stepped in and I was like, right, coming in as a pharmacist, there's no store manager. So for the next month or two, I'm acting almost like store manager during this whole thing as well, just trying to provide a bit of leadership and direction.
Amazing.
Um, and for those older pharmacists, you might remember MURs. Um, I stepped into this pharmacy in November, and there was still like 300 MURs to do in the next 3-4 months. And I was like, there's no one been doing it. They just stopped doing it. And the manager that was leaving just stopped asking about him. And the dispenser was like, we can't force the pharmacist to do it. So I was like, right, every single one that I can capture, I'm capturing it for the next 3-4 months, making sure we deliver the 400 MURs so the area manager's not going to be on my back. And then come the next financial year, obviously you start from scratch and trying to capture as many patients, trying to have as many interactions with patients, trying to deliver all the services. That first year that I was there, like the first financial year, at the end of the year, our little boot store, which is a tiny little store in London next to the station, we finished third in the company, in the whole company, in terms of how we'd gone above and beyond delivering where our targets were versus what we'd actually delivered. So yeah, that's
Wow.
managing your area manager. To be fair, as long as you're delivering what you're supposed to be delivering, they kind of stay off your back. Sometimes I remember one interaction with my area manager when he came in. He's like, Abid, how are you promoting this new foundation that we've got? I said, what are you talking about? And he said, this new foundation, we've just launched it. We're trying to get the whole team to promote it. How are you doing it? I said, mate, I'm a pharmacist. Don't waste my time here coming to talk about foundations and creams. I was like,
Isn't
I'm
that
here to do.
foundation?
Yeah, like foundation, not foundation
At
placement
first, I
making.
thought you meant, yeah, at first I thought you meant like a charity foundation.
Charity, yeah.
Don't
No,
tell me he's asking you
Oh,
about
he's like,
foundation.
he was like, how are you promoting the protect and perfect? And I was like, I'm not. He was like, what do you know about it? Nothing. It's not my job to promote I'm not number 7 consultant, I'm the pharmacist. And he said, oh, we should all be getting behind it. I said, listen, mate, I'm doing this, please, just leave me to it.
Yeah,
And he just kind of went, oh, he just went, okay, fair enough, I'm not going to get anywhere here. But yeah, the area managers and to be fair, I had a new store manager shortly after that, and she was brilliant. She was actually a really good manager. Where she just went right. She knew that kind of Abid takes ownership of the pharmacy. He knows what he's doing. I'll leave him to it rather than kind of trying to micromanage, which is a lot of what happens in Boots. So it's just a question of I just went, right, you just leave it to me. I'll deliver everything you need delivering. I'll make sure that our pharmacy is kind of top of the charts for everything that we need. And obviously, the better service you offer your patients, the more you're able to actually help them get out of a consultation or interaction, the more likely they are to come back. And you see that then actually generates into kind of revenue and the deliverables like prescriptions and services and things like that. So yeah, that's in terms of how you manage the people in Boots. Don't get me wrong, there's a lot of people that are not so nice in Boots, so you just kind of stay out of the way.
Guess that's like life a little bit.
Yeah, exactly.
Yeah.
Um,
Now, you mentioned about Wells Pharmacy and you had a lot of autonomy there. What's the biggest things you learned from that? Because coming from Boots to Wells is so different in terms of how much leadership you had and autonomy and stuff. What's the biggest things you learned? And was there any kind of failures in that because you had so much autonomy? And how did you overcome that?
To be fair, it was in terms of the pharmacy side of things, it's just pharmacy as usual, right? You just make sure you deliver what you need to deliver. But then now I went from kind of being the pharmacist or the person in charge of the pharmacy to now being the store manager. And I think then it was a question of now I've got to learn about sales plans. I've got to learn about, I can't remember what they're called now. It's been such a long time, but the what goes on the unit at the end. What's the promotional thing we're looking for right now? Then I had to learn all the HR side of things because that's not something anyone ever teaches you. All the rules around sick pay. I walked in and there was my dispenser was like 7 months pregnant with nothing set up for her. And I was like, what the hell do I do here? Like, I need to get maternity stuff put through for you. I need to set a date. I need to make sure there's a risk assessment done for you. Like, you've been working 7 months pregnant with nothing. So I'm like, right, find out all this stuff, get it all in place. And the autonomy is great because it's not like they just left me there with no support. You're still working in an organization where you've got someone that you can contact at any time if you need support. You're still working in an organization where you've got an area manager that, to be fair, he was very hands off, left me to it, which I preferred. And I think because he saw that I was quite autonomous, I didn't constantly need checking up on. He left me to it. Whereas I think managers, he kept a bit more of a tighter look on, just because he knew that they constantly needed that little push, that little shove. Failings wise, to be fair, I can't think of any. I think my time at Well was just generally very, very positive. I enjoyed it. I learned loads. Managed 3 different pharmacies, and yeah, I really, really enjoyed it. I can't look back and think there was anything negative or anything that they didn't quite understand. I think maybe in terms of Boots, they were very strict on everything. You're very restricted in terms of what you could do, but at the same time, you had processes, and their whole operation was basically waterproof. It was so tight. if they were losing money from anywhere, they knew where they were going, losing money. I think Well hadn't developed to that level yet. They had operations and stuff like that in place, but they just weren't operating at a watertight level like Boots were. So it gives you a bit more autonomy, but also at the same time, sometimes you're just thinking this process could be a lot better.
Yeah, it seemed like you had to learn so much, like personally during that time, like things you were saying in terms of just sick leave and just, so that's pretty crazy. Gone through a lot of journey.
Yeah, like that. God, that sounds like a lot. Honestly, I don't think I can imagine learning about HR things when you just want to be able to do your clinical role on a day to day. How did you kind of like, even just like stepping back, going back to Boots and stuff? How did you get the drive to literally go in every day? Because you knew it would be a tough day because especially in the time when you're trying to build up all these MURs and you're working in the city, it can be really fast paced. You've got, especially Moorgate, right? Like that's like I guess the banking central, isn't it? Where it's just so busy.
Yeah.
How did you get the drive to just do it every single day?
To be fair, I think part of that is probably from the kind of attitude, the outlook I have towards working, employment, etc. I probably get that from my dad because my dad's a bit of a workaholic. And you grow up. We grew up kind of very. I wouldn't say poor, but not very comfortable. So it was always like, right, actually, I want to make sure that when I'm older, I work hard. I get a good salary. I work hard. I progress. I develop so that I can provide my family with more comfortable things. So we don't have to kind of live the way we did when we were younger. Make sure that my kids, when I do eventually have them, like that's my thought process then. Now I've got 2 kids. I look back at those times and think, oh, the nights where you had uninterrupted sleep,
Yeah.
the money in your pocket to spend on whatever you wanted, the time just to do whatever the hell you wanted. I miss my PlayStation 5 or my PlayStation 4.
Oh,
That's how long ago yeah, 6 years ago, 5 years ago, I had my daughter. And since then, I haven't played PlayStation. So it's like, right, I used to play PlayStation all the time.
yeah.
But all these things kind of drove me because it's like, right, I want to make sure that my level of living is a lot more comfortable than what I grew up with. I can help support my parents. I can help support my family. And when I do have a family of my own, I should actually give them a good life. And that's kind of a lot of it is what propagated my drive. But also, I think just that hard working ethic that you pick up from those people around you. Your parents will instill that in you that you have to work hard, you have to do this, you have to do that, and it just becomes part of your kind of founding motivations to go forward and do these things. And then also, I don't know if you guys get this. But I've spoken to a few other clinicians and nurses and stuff, and they get it as well, where you feel that you've got a sense of duty to your patients, right?
Definitely.
You want to give them, you want to do the best you can for them. You don't ever go into a consultation or an interaction thinking, I just want to get this over with. This is just a tick box exercise. Whenever you go in there, you want to make sure you try and support them, you give them as much as they can. And that's probably what drove me a lot in that Boots environment as well, to actually make sure that I could give my patients the support they needed. A lot of these guys in the city were kind of they were working so hard they couldn't go to the GPs. It's not like they were like they had a choice. They only had that choice of coming into the pharmacy because they couldn't afford time off work. So unfortunately, I'm their port of call. The pharmacy is their port of call. If they come in and I'm like, "No, you need to go see a GP," I'm not making a decision on that. That person then loses a day off work, a
Right.
day's salary, and it's you try and do as much as you can for these guys. Don't get me wrong, it works the other way as well. Where sometimes you're like, you need to go to a GP, and they're like, no, I need to go back to work. But I got loads of stories about that kind of stuff. But the most extreme example, someone came into the pharmacy. Oh, someone's fallen down outside. Can you help? I've come outside and there's this woman in the middle of the pavement having a seizure, right? She's having a full-blown epileptic seizure. Everyone around her is just walking past because they're all trying to get to work. No one's really stopped to give her, to check on her, basically. So I've stood there because you can't do anything when someone's having a seizure. I didn't have any midazolam or any rectal diazepam that I'm going to give in the middle of the city of London to her. So I'm just like, right, just let her have her seizure. So she had a seizure, and then she was kind of on the floor, put in a recovery position. Then after 2 minutes, she kind of woke up. And she's like, what are you guys doing? And I was like, I'm trying to explain, like, that you just had a seizure. We need to call an ambulance. She goes, no, I need to get to work. I was like, no, you've just had a seizure. Like, you need to go to the hospital. No, no. I've got a meeting that I need to be in about 15 minutes. I need to go. And I was like, Jesus Christ, mate, you've just had a full-blown epileptic seizure in the middle of the road, and you won't even stop or take the time off work to go to the hospital. And unfortunately, there's loads of incidences like that. People coming in with anaphylaxis saying, once I've given them the EpiPen, can I go back to work? No, you can't just go back to work. You're on the verge of death 10 minutes ago. Oh yeah, but I've got a meeting, or I've got meeting clients. It doesn't make a difference. My advice would be don't go back to work. You need to go to hospital.
Yeah.
But unfortunately, a lot of them.
Puts everything to perspective when you say it like that completely.
Yeah.
And like seeing that so firsthand, like so many examples you said you have like that, what makes you act differently now, like in your day to day, like seeing that, like people working so hard, doing their stuff, like taking their well-being, like making that secondary essentially. How do you navigate that, and like, what have you learned from that?
So I probably should take away more from that, to be fair, because I do work a lot. If you ask people around me, people that I work with, my wife, she'll tell you that I work all the time. Unfortunately, that comes part and parcel of being like a manager. You never switch off because you might get a phone call at 6 o'clock in the morning. You might get a phone call at 11 o'clock in the evening, kind of say, I'm not going to be in tomorrow or whatnot. But the thing is, it's a question of when I have my time, I have my time. Right? If I'm going on, for example, I was on holiday 2 weeks ago. Is that right? Turn the emails off, delete everything from my diary for the next week, set up the automatic reply so people know I'm on annual leave, so no one's going to be texting me or messaging me. I've let everyone know that I'm on annual leave. If you need anything, contact this person. So actually, the week and a half that I was off, it was a week and a half off from work. I'm not doing anything. I'm not messaging anyone. I'm just literally abroad, running around after my kids. It was harder than being at work. Yeah, it was hard. It was a lot harder than being at work. But yeah, and I think to put into perspective, you talk to a lot of people and you think. I remember when I was working. I can't remember which store I was working in, but I was working in a store a little while ago before I came into this position, where it was very intense, very hard, right? And I was always tired. I was always in a bad mood, and kind of I realized, and like my wife kind of went, "Look, what's going on? You seem so stressed." I was like, "Oh, it's just work." And it kind of forced. And when she picked up on it, she's like, can you not ask to move the store or something like that?" And at that point, I realized that, you know what, work is affecting my personal life. I go to work to provide a better life for me and my family. But at the same time, work is taking me away from me and my family. So I try really hard to make sure actually I have some form of balance, to make sure that actually I get home every night to put the kids to bed. That I spend time in the morning giving them breakfast. That on the weekends I try and make time to play, go out or play with them, have quality time with them. Even if I'm just sitting there doing colouring with my daughter, like just basic things like that. And it's really hard to try and balance that. But I think, you know, as a working parent, you have to try and do that. And it is hard, and you have to make sacrifices. Whether that means the family, you sacrifice some family time, or whether that means you sacrifice something in regards to work. You try and balance them both, so you kind of making sure you're not neglecting your family, but at the same time, you're still getting what you need to in terms of work.
Yeah, no, good for you to set those boundaries, because it's so hard. Like, we all do it, like when you go on holiday or something. Might just check one email, and then one becomes two, then three, and then before you know it, you're just checking everything, or might be replying to something. So setting those boundaries, like you said, is so important. And once you've decided on that kind of decision and you don't do it, then it becomes easier as the days go.
Yeah.
And I feel like we always do it as well. Like, let the hardest things, let them out on the people closest to us. And like you were saying, your wife and your kids, and you don't mean to do it, but it's always the ones that are closest to us always get affected.
Yeah.
So it's amazing that you've noticed that and like changed the little bits and stuff that you can do in your day to day. But yeah, just moving forward, just in your career, you said you went into PCN after the community side. What made you want to take that leap into PCN, like leaving all your community kind of background and everything, and then taking that jump into PCN?
So I spent 5 years in Boots, right? Just over 5 years. And when it was my 5-year anniversary in Boots, I got my manager got sent an email to say Abid's been in the company 5 years. Congratulations. So my manager said to me, "Oh, Abid, you've been in the company 5 years. Congratulations." And I was like, where's the recognition, man? Like the stuff I've done for you guys in the last 5 years. The fact that, we're delivering all these services, working my butt off to make sure that the patients are good, all your deliverables are delivered, to make sure the patients are happy, the staff are happy, managing the teams, etc. And all I get is oh, you've been here 5 years, well done. And to be fair, at that point, working in community, I was like, my clinical knowledge is just day by day getting worse. I know all the OTC stuff, I know the PGD stuff, but in terms of the prescription medication, half the stuff I was giving out, I had no idea what it was doing anymore. So I was like, I can't remember what any of this stuff is. If a patient's asking me questions about the medication, I'm standing there on the computer Googling what it does. And I was just like, right, actually, I got into this to be a pharmacist. So I was like, right, that hospital is one of those things where it's a massive jump to go into hospital. So I've never fancied kind of working in it. Kind of scary, to be fair. Probably a little bit intimidated by the fact that, there's hospital work out there. I would never, at that point, felt confident at all to go into hospital. So I was like, right. At that time, the PCNs weren't really up and about, but there were a lot of practices kind of hiring GPs. Not a lot, but there was a few practices hiring GPs. A few different companies that were starting to kind of do some of that work. And when I was in Boots, I was applying for a lot of these, but everyone wanted experience in primary care. It's a new job, Who's got bloody experience in primary care when this job's just come out? No one. All right. Have you got experience with working with GPs? No, because in the city there's no doctor surgeries.
Right.
Have you got any experience working in a surgery? No. And then clinically, what do you know clinically? And I'm sitting there thinking, I don't know a lot clinically, to be fair, I'm not going to lie. Whereas hospital pharmacists going for these jobs were already clinically much better off, had much better experiences working with prescribers and other, in an MDT fashion. So at that point, I was like, right, actually, do you know what? I kept trying to apply for these jobs. I was like, I'm not getting anywhere. And I was just getting more and more frustrated with all the restrictions in Boots and the way they kept trying to change everything without taking our opinions into it in terms of what we felt about the changes. So I just went, right, do you know what? I've had enough. I'm going to Well. I applied for a few different pharmacies, and Well was just like, right, it's not as corporate as Boots, but there still is that organization and that kind of tree that you're in where you're slightly protected. So I thought this is a transition. And then I spent a year and a half in Well, about a year in the Aveley branch, which is based in a GP surgery, right? The pharmacy's tiny. Literally, like, I've been in bigger bathrooms than this pharmacy, where you literally, if you're trying to walk down the corridor, you have to let the person come down before you can go up, because there's not enough space for two of you to walk past each other. And it's like, right, at this point, I was like, I need to start wearing antiperspirant because we're literally standing on top of each other. I do not want to smell in this tiny little store. But then working in there, because I'm working in the GP surgery, and then I build relationships with the receptionists, the prescription clerk, the doctors, the nurses, to the point where, they feel comfortable to ask me questions. I feel comfortable to ask them questions. The doctors would come out and go, "Oh, listen, this person wants this, but they've got this. Is it safe to give it together? Is there an interaction? Yeah, there is, or no, there isn't. Okay, what else would you recommend?" I'm like, you could give this or you could give that. And they're like, "Okay, I'll give them this." And I would like, "Make sure you give it this brand. It's a lot cheaper." So I'm already doing the medicines management thing in my head over there without even knowing what medicines management is. The prescription clerk would come around and go, "Oh, Abby, can you come around and give me a hand? I just need," like, she'd say, "Can you come and have a look at this on the system, or can you come and have a look at these prescriptions?" Just because I don't know what to do with them. And I'd go around and help the prescription clerk with her prescriptions. So I'm standing over the shoulder helping the receptionist, the prescription clerks, the doctors, and I'm learning system 1 secondhand. So over the shoulder, I'm like, do this, do that, do this. To the point where when the prescription clerk went on holiday and they had the kind of like receptionist that would cover her, she had no idea what she was doing half the time. So she'd be like, "Abby, can you come back?" And then I'd go help her go back to the pharmacy. 5 minutes later, "Abby, need your help again?" "Yeah, that's fine." Then go back to the pharmacy. So in that way, I was kind of learning all this clinical knowledge was coming back, right? Because I'm utilizing it now. I'm in a pharmacy where the doctors, the nurses, the prescription clerks, they're asking me clinical questions. Whereas in Boots, it was OTC stuff. I could tell you what's included in a meal deal off the top of my head like that. But, what half these medications do, I'd have to Google it. And that was the worrying thing for me. And that's probably the main reason I left Boots. But yeah, so working in Aveley, I've got that doctor interaction. I've got the MDT approach with different decisions. I'm learning system 1. And then this job came up, 6 years ago now. And I applied for it. And I went to the interview. And I thought the interview went all right. I can never tell how an interview goes. Some people come out and go, "I smashed it." Some people walk out and go, "I flopped it." I walked out and I was like, I genuinely have no idea how any of my interviews go. Similar to this, I just sit there and just talk for an hour, and then I walk out thinking, hopefully that went all right.
I'm the same. I don't know if I need more practice. I was saying this to my husband the other day. I was like, I don't know if I need more practice in job interviews, because I actually can't tell. You just
Yeah.
don't know if you're doing the right thing or the wrong thing. But hey ho.
Yeah, I think it is tough, because unless you're comfortable listening to the sound of your own voice, and kind of in an interview, you're supposed to big yourself up, aren't you? And that's really awkward trying to do that at any stage in your life. Like, "Oh, I've done this and I'm doing this and I'm like that and I'm like that." Similar to this podcast, I'm sitting here trying to kind of tell you what I've done, and I'm like,
I think it's amazing.
no. So
And
yeah, so when I went
yeah.
for this job, had the interview, and then she called me back the next day. This was my to-be manager at the time, who was a nurse, Liz Harrison, who was amazing, right? And she called me back the next day, and she was like, "Oh, we're really impressed with your interview, but we've only got one position, and there's two other pharmacists that are kind of coming in that both have a lot more clinical experience. But we were really, really impressed. So we're going to see if we can do something to try and bring you on board. I was like, okay, fair enough. And she called me back 2 days later to say, yeah, we rejigged it and we've made another pharmacy position. So we'd like to offer you the position. And I was like, yeah, absolutely.
Amazing. That's
Yeah.
fantastic.
And initially I kind of went back to my wife and I was like, look, I've got the job. And she was like, brilliant. I was like, yeah, but there is a pay cut. Like there's a significant pay cut. And she was like, oh, how much? And I was like, this much. And then we both thought about it. And I just went, right, do you know what? We're going to go for it.
Yeah.
Yeah, so there was a pay cut with moving into the PCN from community pharmacy. But in reality, it was just a question of, do you know what? The job's going to be a lot better. The hours are going to be a lot more suitable. You're not doing bank holidays. You're not doing weekends. You're doing 9 to 5. And we just went, right, actually, do you know what? For that little bit of money that you're losing, you're getting a lot more life back. And I just said to be fair, if there's any dip in the income, you can supplement it by just locuming here and there. And I did do that for the first few years, but I just locumed here and there just to make up for the pay gap.
Yeah.
But the thing is, in primary care, the more you develop, the more your salary is going to go up anyway. And within a few years, as a prescriber, I was doing this, I was doing that, and my salary just went up to what I was more than what I was earning in community pharmacy. And then since then, obviously, I've taken on a lot more responsibility. So the salary's all right.
Yes. That is
Do you want to tell us a
epic.
bit about your PCN role? Like, because I know, like, I'm from hospital, so I literally know limited about community PCN. But I know you do so much other than the normal kind of trajectory in PCN. Like, do you want to just advance on that a little bit?
Yeah, like your day to
Yeah.
day, as well as like month to month.
Yeah.
How much do you know about what a PCN is?
Me, not much.
Let's
As
go
in
with
the
no one
fun-
knows anything.
Yeah.
Oh, okay.
The
So
basics.
no, that's fine. That's fine. So the thing is, that this isn't the first time I'm going to explain it. It won't be the last time I explain it. There's so many people when I go work at a PCN, they go, "What do you mean, like a penalty charge notice?" I was like, "No, not that kind of PCN." Um, so basically, 5-6 years ago, the government decided we really need to help primary care. We really need to help GPs, and we can't just get GPs out like this. We can't just pull them out of the ground and go, "Here you are. Here's some support." So let's use some of the additional kind of healthcare stuff that we have, the allied healthcare professionals. Sorry, they know I'm in this room, so they've started calling me. Let me just log out. So they just went, right, let's get nurses, let's get pharmacists, let's get paramedics, let's get other people in that could help ease the burden on GPs. And they thought, right, there's no way you can individualize it for each practice to say, here, you can have this money or you're allowed to this much. You could have a practice that has 2,000, 3,000 patients and a practice that has 20,000 patients. So to try and kind of make it a bit more homogenous everywhere, they said, right, form groups within your areas of GP surgeries, little networks basically and your population size would be about 50,000 patients roughly, and we'll give you basically resources to be able to hire pharmacists, paramedics, yada yada yada, and you could share them amongst yourselves. So obviously that network amongst the primary care surgeries and partners, that's what they call the primary care network. So it's like, right, you probably don't need a pharmacist all the time in a small surgery, but you might need 2 or 1.5 in a big surgery. So if you, rather than trying to employ a pharmacist for half a session a week or 1 session a week or 2 sessions a week, the PCN has now employed 1 pharmacist that can be shared across different surgeries based on their needs and their allocation. So when I first started, I worked across 4 different surgeries. And it's like 2 days at the big one, 1 day at a medium-sized one, and half a day in 2 small ones each. So now I'm learning 4 new ways of working, because all 4 surgeries operate in completely different ways. And I walked in, none of these guys had ever had a pharmacist before. I'd never worked in primary care before. So I walked in, spent 2-3 weeks on an induction, and they were like, "Oh, what can you do?" And I was like, "I have no idea. I'm here, and I will try and help, but I don't know what I can do here." And I was like, is there anything you want me to do? And they were like, "We don't know what you do either." So the first, I'd say, like straight away, you're sat there and you're getting involved, and you're like, right, I've had some shadowing with a pharmacist somewhere else, so I'm going to try and implement some of that here. And the first couple of months, it's like, oh, I'm going to go give this to the doctor, and I'm like, oh, I can do that. I can take that. Let me deal with this. Let me deal with that. And those first 6 months where you're kind of like not twiddling your thumbs, but you're looking for stuff to do, that's a long distant memory. Now it's like, piles and piles of things that are just kind of building up of things that the pharmacist should be doing. But it was great because now I'm in here. I'm involved, obviously, talking to patients, still having that patient interaction, still building these relationships with patients. But now I'm on the other side where I'm actually making decisions. I'm reviewing patients' medications. I'm making changes. I'm giving them new medication. I'm following it up. I'm reviewing it. I'm checking the monitoring, etc., etc. So, now I'm in a situation where I'm a lot more clinically involved than I ever was before. So that's a very, very that's a very steep learning curve. So yeah, going from selling meal deals to prescribing, actually signing off prescription was a big step.
How crazy is that?
I know.
But